Hi guys, so I am going to be putting together a series of videos with some helpful links and extra quizzes and anatomy and all of the stuff you need to know for our positioning classes here at Kaiser. So anytime you need extra help, you can refer back to this video, and then the links that I have will be posted and accompanied it. So first off, we're going to start with the hand and wrist radiograph. That's our first extremities that you'll do in 1513, RTE 1513 course. So the hand and wrist will show the video, and I'll give you some extra help and tips as we go along. So first I'm going to share our screen so you can see some of the links I have and the video I'm going to show you. Wrist, hand. So we've made these positioning videos in the lab just to show you how quick and easy you can go through the routine views. I went back over it and added sound, so hopefully you will be able to hear all of that today on the recording that I'm going to replay here for you. These will also be uploaded in your course on Blackboard.
The hand positioning. So for the hand, we're going to do PA oblique, and lateral. 40-inch SID for all of these. That's 10 by 12 portrait. Central ray is the third MCP on the PA and the PA oblique. The lateral is the second MCP joint. Specifically, that's where it hits first. It's still going to be going through the third MCP, but the book states second MCP for that. The patient is seated at the end of the table with the hand and forearm in the same plane. So we don't want anything leaning, everything level on the same plane. And we want to make sure to do that so that all the joint spaces will be open and visible on all views. So if your hand is lateral, that's going to have some fingers raised. We do not want them laying down on the IR. We want them on the same plane with each other so we open those joints. Breathing instructions, there's none needed. Just have the patient hold still, don't move. Clinical indications, fractures, dislocations, foreign bodies, pathological processes, such as osteoporosis and osteomyelitis. Okay, we're going to look at our video. Full body shield and thyroid shields needed. Not playing too well. All right, so hand palm down, all on the same plane. Center to the third MCP. And collimate down past the carpals. And change out your IR. And you're going to do your oblique. It's a 45-degree oblique. You can start by having the hand kind of at a slant with your fingers down, but then we're going to need to have them all on the same plane to be a good oblique so that we don't close the joint spaces. So that will have closed joint spaces. Now we're going to do a fan lateral. Look at two laterals, specifically look at the fan lateral. Second MCP is where it's going to hit, going through the third MCP. All the fingers fanned out. That we also want to make sure they're all on the same plane. Sorry about that, but I went too far down. So our PA hand should look like this so that when we're looking at our fingers, the soft tissue should be equal on each side. Also, the shape of the convexity of the phalanx should be equal on those sides. We should see the tips of the fingers, the soft tissue included, all the way down past the carpals to get the wrist joint included on our PA hand. The thumb is going to be in an oblique position. So it will show unequal distance on the soft tissue, and the convexity of the phalanx is going to be a little off on that first digit. Should be able to see all the joints open, the DIP, the PIP, and the MCP, and all of the phalanxes, distal, middle, proximal, and the metacarpals. Then we have our oblique hand, PA oblique projection. This one, you are going to see that the soft tissue is unequal on each side. You're going to see the convexity and concavity off on the bones of the phalanx. So it's a little more curved on one side than the other. The head of the metacarpal should not be overlapping the bony base of the proximal phalanx. The third should not be too much over the fourth. The fourth and fifth could be about 1/3 covered, but if the third and fourth are more than just slightly touching, that means they have over obliqued the hand. So this one is slightly too much. Come down to the IR just slight to help with that head not being overlapping on the bottom of the phalanx. And then we have our fan lateral. This one is clipping the top of the third. So we have all of the fingers spread out so you can see them. All of the metacarpals are on top of each other. And that lets us know we have a good position of the hand for the lateral. If it's leaning backwards or forwards, those metacarpals are going to be spread out where you'll be able to see individual metacarpals. The thumb is usually in like an AP looking position here because it's flat towards the IR. So this one's going to hold it, kick back, twist it back, but nicely fanned out. We just have to fix that collimation a little bit so we're not clipping the top of the third digit. That is the end of the hand. So PA, PA oblique, and lateral.
All right. So hand is our first real extremity that we're going to focus on. We'll do fingers a little separate in the lab. I want to show you some of the book anatomy for the hand. This is a presentation from PowerPoint put into Prezi, so you can just click through it. So it's chapter 4 in your book. So we have the bony anatomy that you want to know. Each first digit, second digit, third, fourth, fifth. Each one of these, you want to refer to them by the digit and then the part. So the phalanges, which is our fingers, the phalanx is each little section. So we have a distal, a middle, and a proximal phalanx that make up the phalanges. Then our palm of our hand are bones that kind of have the curved head part. That is our metacarpals. So number 2 metacarpals, first, second, third, fourth, and fifth metacarpal. And then after that, we have our wrist bones, our carpals, and we will separate them out and name them when we go over the wrist. The bones themselves have a body, the long part, a head, which is here, the rounded part, and then at the bottom we have the base, the flat part. Where those areas connect, we have joints. So we're going to go to the next one. So on the thumb, you just have a distal and proximal phalanx. So we have an IP joint here, and we have our metacarpal connecting to our first phalanx. So that is our metacarpophalangeal joint, or MCP joint here. MCP joints here, where the head of the metacarpal meets the base of the phalanx. So that's our MCP joint, first, second, third, fourth, and fifth. The special thing about our first digit or our thumb is it only has 2 parts for the phalange, the proximal and distal phalanx. Digits 2, 3, 4, and 5 have a middle phalanx. So we have 3 joints on them, a distal interphalangeal joint, or the DIP, the DIP joint, proximal interphalangeal joint, the PIP joint, and then again, the metacarpophalangeal joint, the MCP joint. At the back where our metacarpals meet, the carpals is the carpometacarpal joint, the CMC joint. And then here's where you'll see our wrist bones labeled. So we usually start on the thumb side where the scaphoid bone is, and that one's not labeled here. So again, these bones we're going to get into when we go over the wrist. There's a radiograph with everything you could possibly be quizzed on or asked on a test, pretty much. And then we have the carpals, and I'll come back to those in a minute when we get to the wrist. So for some of the Quizlets that I'll link, I'm going to go just to one or two here. This has a radiograph, and then you can click on it and see the anatomy that is here for you to review, and you can play games to learn it. That's one. That's that one. And lateral. So I think I went to the same one. So on the lateral, the fingers are fanned out and the metacarpals themselves are overlapping each other. I believe you can zoom in, yes. I'll have different Quizlets, or sometimes I'll have something called a Socrative quiz or even a Kahoot quiz for each thing. Let's get back to the video and we'll look at the positioning of the wrist. So we have our 3 views for the hand that we just went over, and now we're going to look at the wrist.
So for the wrist, we have 3 views, a PA oblique, and a lateral. So our routine views, 40-inch SID, 8 by 10 is the IR size because we're going to collimate small. Portrait is the orientation. Of course, in our lab, we're going to use a 10 by 12 and just collimate small on it. We don't have the 8 by 10. We have 1 or 2, I think, but anyway, just know that 8 by 10 is the preferred IR size, small collimation. Central ray to the mid-carpal areas for all the views. Patient's going to be seated at the end of the table with the hand and forearm on the same plane. The PA oblique needs a 45-degree obliquity externally from your PA position. The lateral is going to be a lateral medial projection. So that means the pinky finger down. Breathing instructions, none are needed. Just tell your patient, hold still, don't move. Clinical indications, fractures, dislocations, foreign bodies, pathological processes like osteomyelitis and arthritis. So look at our video. She's collimated in pretty small, little square, include both sides of the joint, center to the mid-carpals, right between the styloid processes. EA. Switching out. We are going to do an oblique. 45 degrees up with thumb. Center to mid-carpal still. And then we're going to switch out our IR and the lateral. Straight up and down like a karate chop. Important on this one is to check styloid processes, make sure they're on top of each other. And that's our 3 views for the wrist. PA view, you should see almost all of the bones that you could label from the scaphoid around. That's on the radial side. So that's where you're going to start counting around from scaphoid to capitate. And then making your way up to the other row, come back over to the radial side. If you're saying your little acronym, you could use some lower strap because it's just they can't handle, or send a letter to Peter to tell him to come home, whatever works for you to remember it. Then on the oblique view, we are going to see it separates out some of the carpals so that you can see the joints between them and around them, specifically near the trapezoid trapezium. And then on the lateral, this one sticks out the best, the lunate. It's that little crescent-shaped moon bone, and the pisiform pokes out. You should be able to tell if it's a good lateral if the ulna is sitting centered in the radius. And that is it for our wrist.
All right, so carpals, pretty easy, similar to what we saw for our hand positioning, the PA oblique and lateral. So now let's see if I can zoom in here. So our distal row and our proximal row. Like I kind of noted there in that video, we start at the scaphoid, that's on the radial side. The thumb side, RT. So when we think about that, the R for radius and the T for thumb, we're going to be an RT when you get done and graduate. So that's where our scaphoid is, the proximal row. Then we have the lunate, triquintrum, and pisiform. It's a little tiny P shaped. And then as we move up, we have trapezium and trapezoid. Capitate is a big cap in the middle, the big one that holds it all together. And then the hamate on the end. So the saying that I learned was some lovers try positions that they can't handle. The book says send a letter to Peter to tell, I don't know, the hymn gets left out, to come home. Tell him to come home. That's just different. There's probably more if you Google search acronyms for it. This is looking at it from the other side underneath, and the hamate has a hook on it. The hook of the hamate, the hamulus. Here's how the pisiform sits, kind of hiding underneath the triquintrum. The lunate here does not look like a moon, but whenever it's turned lateral and sideways, you see a crescent-shaped moon on the lunate bone. There's our mnemonic and what they mean. Each bone in the body usually has more than one name, so the synonyms are just some other names. You may see it. I would recommend to know both because I know I cannot tell you what the doctors are going to say or what the book test the registry will say. The preferred terms are probably most likely what you'll hear, but every now and again they might throw a curveball at you. So there's our PA wrist. There's our carpal tunnel area that we're going to get into with some specialty views, the carpal canal. Joints again. These are little charts in the book. I recommend noting the type of movement that they have. So ellipsoidal, our MCP joints, ginglymus or a hinge, the IP joints, plane or gliding is the CMC and intercarpals. And then our special one that you'll see on test, the saddle or the cellar, is the first CMC joint. They are synovial, diarthrial, means freely moving. That's our radiocarpal joint. Now we have special movements of our wrists. We can move left to right, side to side, thumb going in or pinky going down towards the arm. So radial deviation means that the radius is moving away from it. Sorry, ulnar deviation, going towards the ulnar. Radial deviation coming towards the radius. So one way or the other, which way are you moving or deviating from? Ulnar deviation will help open up the area to see the scaphoid bone. And that's a special view we're going to do. There's a radiograph of ulnar deviation, opening up this side. And then ulnar deviation, here's our scaphoid bone that it opens up the space around it. There's our lateral, and this is the crescent moon shape. It takes a second to pick it out. Letter B. That's our lunate. Special fractures that we'll look at, when we look into trauma in the back of the book, we have the Colles fracture and the Smith fracture. One is just a way that the movement of the radius moves, depending on if it moves just posterior or anterior. And then a Barton fracture is just a slip of the lip area of the distal radius area only. We're going to talk about the fat pads more in the elbow than we would on the wrist, but they are small little areas, kind of a air pocket area. They call them fat pads. They look for movement of them or disappearance of them to tell if there's swelling. In a fracture, doctors will look at that. So we won't talk about them too much in the wrist. More that I've heard them ask for specific, pay attention to it in the elbow when we get there. These are the same thing that's in the video, the positions. So you can look through this as you need for extra review, make note cards with it, whatever you need to do. For the digits, which we'll go over in class, it's going to be the same positionings, just centering at the PIP instead of the MCP, like the hand, so that we can get the finger on there. All right, that's it for this video. Mainly wanting to focus on the hand and wrist anatomy and positioning. Thank you for taking the time to watch it, and let me know if you have any questions or anything else that you feel like we could add to help you guys.